Dr. Choll came here from sunny San Diego, California. We have a 31-year-old from New Jersey with back pain, pelvic dysesthesias, left leg pain, and this disc herniation. So we're going to do a minimally invasive laser endoscopic discectomy using all the latest, greatest technology so that he can get back to work and living life as soon as possible, because one of his hobbies is Muay Thai, and that's my favorite sport. And that's how I stay fit and exercise, because I hate working out, but I love hitting things. And I suspect he's very similar to me, so we got to get him back out there. Alrighty, I'm getting started. The first thing is to create the perfect entry point. So I'm finding the bullseye before I even make the incision, using intraoperative imaging. And I have the black belt radiology person who already has a perfect lateral for me. I think I like that right there. And before I make the incision, I anesthetize the tract and at the same time use the needle to confirm that this is the perfect entry point. No, I used to make the little stab incision first, then use the needle, but that's silly. So once I find the perfect entry point, I use the spaghetti noodle dilator to guide my way down there. And this is where the dark side of the force comes in. Not only am I using intraoperative imaging, anatomic localization, I'm like Helen Keller feeling my way down. And that's why I call that the force. Alrighty, I have this tiny little skinny needle in the middle of the disc. Shot there. And I'm going to inject that in the middle and watch it leak out. Shot there. Oh, it's already leaking out. Look at that. It's going, and it's outlining the outer part of the disc just like it's supposed to. It read the textbook for me before I injected it. The cannula in. Look at those little spot welts from the laser. Anyway, I've got the tip, and I'm going more and more to the middle where the disc herniation is, and look, all of a sudden I can see this blue hint right there. That should be completely white like the rest of it, but that's where the leak is. And I can feel that the dural tube is stuck down to it, because that's the other thing that happens when you have a disc herniation. You get inflammation and epidural fibrosis, and if I push down on it, it almost acts like a pimple popping device. I know it's gross, but it's true. Alrighty, I'm almost there. And it's going to be really, really dark blue here. There it is, and I'm pushing down on it. You can almost sense that it wants to squirt out like a pimple. But just like my teenage kids, it's not going to come out without a fight. So I need to do some more work. This is an example of a pathologic annular tear. It should be completely avascular, but it's got all this redness right there. And that's what we call granulation tissue under a light microscope, because it's just lots of little blood vessels filling in. And of course, it's right next to the bone. It's going really well. I'm finding all the pathology that I want to find. It helps me predict that you're going to get a great result. Okay. One of my favorite instruments, the side-firing holmium laser. Look how beautiful this works. If I don't have the laser, I have to remove that mechanically with a little grasper. And it's really annoying. And it's not nearly as precise. That red laser is just the targeting laser. It's not the actual laser. It's the laser like you have on your pen.
What's this, the targeting laser?
Yep. I don't think you can actually see the holmium laser.
Yeah, no, you can't. It's on the invisible light spectrum.
That was Adam, my favorite laser tech. He's been with me for over 10 years. He knows me like the back of my hand. He's seen it all. Just making my way more and more toward the disc herniation. So that gelatinous blue stuff right there, that's the caca-poo-poo. This is a little bit of caca-poo-poo. This is what it came from. Yep, you can just see it. Look at that, how that dark blue line comes up and becomes the blue gelatinous thing. It's supposed to be white. And there's the annular tear right there. So the treatment is to remove the fending agent and reinitiate a new healing response, and make sure that the nerves are no longer adherent to the scar tissue. And that's basically the surgery. It's not a mechanical decompression, it is a biologic treatment, sort of like tennis elbow surgery. And if anybody's had tennis elbow like I do right now, oh, it is painful. Muscle pain and tendon pain is something else. It is the most painful thing. It's way more painful than arthritis pain. almost as painful as real nerve pain. Real nerve pain is not so intense though. It's just constant. Whereas muscle spasm pain is intermittent, and tendonitis pain is a form of muscle pain. Okay, so I'm going more and more medial, and here's the entrapped fragment right there. It's like a little poop. Oh yes. I'm feeling really good. I'm right at the abnormality. The abnormality, it looks abnormal. It's always nice to see things like you expect. I hate it when I'm like, huh, I wasn't expecting that. That's not cool. Sucker is pesky. Thank God I have the laser. Without the laser, you have to do everything mechanically. How would you finish? How would you get all these pieces out, Dr. Han, without the laser? Just like this?
Forceps and cutter.
Yep, forceps and graspers. You just keep going like this.
But need more 20 or 20 minutes.
Oh, that's so annoying. More laser. Look at how magical that is. If you don't use the laser, you have to remove all that with the mechanical instrument. It's a total pain. Yep. He just jumped too. The nerves are working, thank you. And Brittany's the real deal. She's actually helping me. Thank you. Okay, so if you look at the X-ray over there, you can tell how far across I went to the right side. That's exactly where the margin of the disc herniation is. So that's how I know, besides looking down here. There's no more loose pieces. Remember that gelatinous piece up there? No more. And then here's the scary part. Look at this. That's the dural tube in the nerve. Look how red it is. And I bet you it's going to start pulsating. Watch. Yep. One. Woo, look at that. Bleeding's pretty good. Oh, yes. That looks really good. I'm very, very happy. I hope you end up being happy and getting a lot better. Otherwise, I'm going to be very sad. Surgery is all done. We did it through a little poke hole. It went so well. I can't wait for you to see the video. So best wishes on a speedy recovery. I'm going to put this Band-Aid on once it dries. And thank you to Dr. Goldstein for all the wonderful work that you do to help these patients. Right, guys?